Hi and welcome to #Podblog. I'm Tom and this is Gareth, and today we're going to talk about injury prevention.
And we're going to go through 7 top tips and just rattle through them really, and what we think can help you.
We are seeing our clinics becoming busier and busier, especially after people taking up their New Year's resolutions. And certainly we're here to give you guys some advice on how to continue injury free. So I reckon if we just kick it off, number 1.
Footwear, obviously hot topic. You need to be looking at your footwear. Make sure that your shoes pretty much have got some good grip, the cushioning still there, and all the factors you want with a shoe that's going to be able to get you to your first event. Yeah,
I think people often ask, when should I change a trainer? And I think manufacturers, they're quick to give you mileage because they know that certain people will achieve that very, very quickly. I'm not a firm believer in that, because I think there's too many factors to consider when you look at shoe wear. I think obviously making sure the lining of the shoes are in one piece, make sure the uppers are in one piece, make sure the rubber is still where it should be underneath and it hasn't ground out to nothing. And yeah, just generally keep a good eye on your footwear and make sure that it's still doing the job it's designed to do.
The undersole for me is a big one. Just keep an eye on their grip and the wear patterns.
Yeah, I think especially with a few brands these days, they didn't often put too much grip on them, so you tear through it and before you know it you're in the soft EVA midsole and it's changing everything. Number two,
yeah. I think I say this a lot in a lot of the pods we've been doing, the blogs we've been doing lately. I think progression's key. I think we got together today and we were discussing how Tom's training's going lately, and he said he's learned so much from previous years. How was it 3 days a week you were running and you broke down quite quickly?
Yeah, when I started training, and I think where a lot of people find themselves coming into the new year is they put on a bit of extra weight. And everything about them is geared towards getting fit, losing weight, and they want to do it as quickly as possible. And I've certainly been a victim to that in the past, and found that this time last year I started to really struggle with my shin splints, and basically medial tibial stress had kicked off, and I just pushed too hard too quickly. And I think the main area for me to take out of that is very much just to build it up nice and slow. Listen to your body, let your legs dictate how hard you push and how often, and don't be afraid to rest. I think that's such an important piece of advice. If you're tired, do something else. Give yourself an extra day's rest on those legs. Go and do some different work, whatever that might be, strength and conditioning.
Yeah.
But don't be afraid to have that extra day to give your legs a bit of time to recover.
The research now says that you should follow the 10% rule, so increasing your mileage by 10% once a week, and then around 6 to 8, depending how you feel, have a deload, reduce those miles dramatically, do a week of cross training, go and swim, go and do some non-active,
there's plenty of options I think out there, whether you're building muscle, or as Gareth quite said, whether you work in other areas of the body aerobically, whether you're swimming or whether you're on the bike, but just reducing that day in, day out trauma that you apply to a leg through running is certainly worth considering, especially when you're starting.
Yeah, number 3, I think we need to change it up. A lot of people like to go long all the time. Add some speed, change your training up, do some interval training. Don't always go for, okay, I'm going to run 13 miles today, or I'm going to do 6 miles. Maybe go and join your local track session, or change it up. Go and see, and just don't get stuck in the traditional, I'm going to run this amount of miles on these splits.
Anymore, it's not a case of, in order to, for example, I'm training for a half marathon. You don't have to run big every day or every other day or how often you train. It's so important to mix it up with some speed work, get some intervals in there. I'm doing sessions where I'm running 5 minutes on, 3 minutes off, and on the 5 minutes on, I'm setting myself, very personal targets of say 7 30-minute miling, and then on the 3 minutes off, I'm recovering and trying to breathe for 3 minutes at a very slow pace, and then I'm back up to a slightly faster pace, and I think it mixes up your training, but it definitely adds something different and adds a benefit to what I'm trying to do.
And that moves us quite nicely on to number 4, would be seek out different surfaces. Don't just run around your local block all the time. Go and do some trails. maybe go for a hike or go rambling. You're still building volume, so don't always get stuck on road running all the time. Maybe go, like we said, to your local track, do some trails, go down to your local rugby pitch and do some shuttle sprints. Don't always run on the road.
Changing your routes as well. You know, I've got a set route that I run, and we did a long run last Sunday and decided to start at a different time of day and go for a completely different route, and it was lovely. And then to be out running down Cardiff Bay, across the barrage, just mentally as well as physically, having that change seemed to make such a difference, a positive difference for me.
I think that's a good point as well. If your goal is to do, like you're doing a half marathon, to train the time that you are actually going to run. So obviously most things are early morning. If you're training at the night all the time, when it comes to that event, then make sure that you're prepared and you put yourself in those type of environments. So we won't go into that much nutrition and all that, but that's something you can work on then, strategies going forward.
Yeah, absolutely.
Point 5, I'm a big believer in this, cross training is key. You don't have to be running all the time.
No, I think certainly looking at the evidence now and listening to coaches, I think a lot of it is being pushed towards how important things like strength and conditioning is, even to runners. You know, a while ago it was all about just putting miles through legs, and certainly I think there's a big shift in training now, and I think it's just, even with running, there's a real sort of drive to get that strength and conditioning, not just in the legs, but you know, core strength and upper body strength as well.
Just building that tissue load, like doing prehab, so doing some activation work alongside your training, doing some band work, it just helps with that full circle. For one, you're probably reducing the chance of injury a little bit as well. If you know you've got a tendency of having Achilles problems or calf problems, put some loading plans in place early, so you're not going to break down when the mileages get higher and the volume and the more stress you're putting on your body.
Yeah. Number 6.
Well, I tell you what, it's quite cold in Wales at the moment, so it takes me a good half hour to warm up for anything. Warm up and cool downs. Obviously, there's a lot of people saying it's needed, there's a lot of people saying what's the point. Personally, I quite like it. I think it just brings your heart rate down after or raises it before you go for your run.
I think it's so easy to fall short on this part of it. You know, certainly personally, warming up, cooling down is something that I think I've neglected in the past. Weirdly, only if I'm carrying, you know, a niggly injury that I will try and warm it up before I go out for a run, which is just totally the wrong thing to do. You know, we should be warming up before every sport activity and cooling down afterwards. It's just so easy to fall into that trap, and and I think it's certainly an important thing to consider, certainly pre-running.
Yeah, something I brought in and I try and promote a lot of my patients to do as well. Example, we'll talk about medial tibial stress syndrome. In your warm-up, maybe doing some drill works, make sure you're not getting narrow, you're not doing that type of catwalk running gait, which we know overloads the medial tissues and promotes that tib-pos overload. Put it into a warm-up, put it into like a training. It's like when you go to the golf range, you're practicing certain cues before you go on the course. I think you can bring that into your running as well. If you know you get narrow and you lose that knee window, maybe doing some line work before you go for your long run, just to practice that mechanism.
So you're warming up, but you're also working on your form as well, by the sound of it. So yeah, absolutely build it in.
Definitely. 7. Last point, it's a big one.
Can't read your handwriting.
So the big thing is, if you've got a niggle or an injury, don't allow it to snowball. Don't think, oh, I'm at the start of my plan, it's a niggle, it's going to go away.
Oh, absolutely.
Because we see it in clinic all the time.
Yep.
Oh, I had this little niggle and I've trained and now it's
shin
agony.
pain is probably, from a running point of view, one of the most common we see. Again, having struggled with that personally and luckily no longer suffering with it. Trying to run through shin pain is a recipe for disaster. You're at risk of a number of things, including stress fractures. So just, stop ignoring your pain. Pain is there as a signal to tell you that something is wrong. Again, with running, you can step in and start to do something about it. Seek advice from professionals. We're podiatrists, we work in these conditions very frequently. You've got great physiotherapists, you've got great sports massage therapists, chiropractors, osteopaths, looking at a team of people that are there specifically to help you through your injury. So reach out and find somebody who can help, because the worst case scenario, either you were forced to stop through injury, or it hurts enough to stop you, and you'll find yourself sat in your living room with that bottle of wine again, not being able to run. So get in there and seek some medical assistance.
Definitely.
Thank you for listening, and we'll catch you up soon.
Check out our website www.feetinmotion.co.uk for further information, or contact us via phone, email, or our social media to speak to a member of the ACE team. Keep following us for more videos. Thanks.